Pete is a reader in psychology and science communication at Bar University. And Pete's current research interests lie in understanding the short and long-term behavioural effects of playing video games. And Pete's going to give a short presentation, which will be followed by an opportunity to ask questions. And his talk is going to focus on games, different types of screen time, what they are, and how to consider what might be appropriate at different ages. So please don't forget to post your comments in the chat box and the questions here, or use the Emerging Minds hashtag on social media. Thanks, Pete.
Thanks very much, Emily. Nice to see everybody here today. So as Emily said, I'm Pete. I'm a reader in psychology and science communication at Bath Spa, and I do work primarily on video games, but increasingly on screen time as well. What I wanted to do today, I think there's a bit of a caveat to this talk to begin with, which is that there's so much stuff, and I think that was evident in some of the questions that we got as well, and the variety of questions. There's so much stuff that we want to and need to cover. We're probably not going to be able to get through everything that we want to say today, but we'll try our best. But what I wanted to try and do with this talk really is just provide a bit of a general overview of some of the recent reviews and research on screen time that maybe kind of give us a footing on which to think about how to navigate what feels like what is a very difficult situation in the home, about how we kind of balance screen time with other sorts of activities. And I guess the first thing to say about all of this is that screen time is basically a meaningless concept in that specific terminology. And the reason I say that is because it just refers to everything, right? So it refers to using social media, it refers to playing video games, using Wikipedia, watching videos, coming to webinars. Literally everything that we do on a screen counts as screen time. And I think that's an important caveat to any sort of research that you look at on screen time effects, because we as researchers tend to focus on screen time as a sort of broad general measure. It's quite a compelling measure to use for researchers because it's an easy number to grab, how much of your time during the day you spent in front of a screen in some way. But what that does is miss pretty much everything that we do on screens. So we can break screen time down into these sorts of categories that you can see here. I've got just 6 here, but we can actually break that down even more. So social media in a sense is a meaningless category because there are so many different types. Twitter primarily text-based, things like Snapchat primarily video-based, Instagram primarily photo-based, and there's a mix of all of these sorts of things as well. Even if you take one of those groupings and dive deeper into it, so if you look at video games, for instance, you can break video games down into the types of video games they are, the genres, how people play them, what sorts of views they see when they play those sorts of video games. So if you just take that particular list there, it's just a random list primarily of games that I've been playing quite a lot recently. But there's no kind of single easy way of categorizing these sorts of things. So some games you can play as both single and multiplayer games. Some are first person perspective, third person perspective. Some are competitive, some are cooperative, some are both. Some are quote unquote violent or action or fast paced games. Others are more kind of relaxing and mindful games. And because there's this heady mix of all of these things, it makes it very difficult from a research perspective to disentangle what potential specific effects there might be of playing specific games. And that's why we kind of tend to default back to these more coarse categories of maybe genres or video games generally. And you can kind of wind that back all up to talking about screen time as this broad categorization. So I think that's the first thing to say. I'll talk a little bit about some of the research from the past year or so in a minute, but as with any work in this area, there are a number of caveats that I think are worth bearing in mind before all of this. First is technology changes quite quickly. Science moves quite slowly, so we're always playing catch up with the research. We've never really got a situation where we're looking at what's happening right now and in the moment. And I think that's particularly important and a bit of a pain for the situation that we're in now. Second thing to say is that experimental studies, so things that you do in the lab where you precisely manipulate and change one variable to see how that affects something else in terms of behavior, those are really useful to interpret and develop causal directional effects for screen technology, but they're really hard to do well. You need lots of people, you need lots of money and lots of tech to do it. And there aren't that many studies out there that do that. As an example of how difficult it is to do this, there's a really interesting study that came out by David Ellis last year that looked at what we primarily use is self-report measures of things like screen time and smartphone use. So you get people to report how much of the day do you use your phone, or how much of the day you on social media and things like that. Turns out that there's lots of different measures of those, lots of different questionnaires that you can use. None of them correlate particularly well with actual objective use. So a lot of the research that we've got out there at the minute where people try and quantify smartphone or screen time use in those sorts of ways, we can't be sure what it is that they're actually measuring. And actually, I saw literally just this morning a study that came out. It's been a preprint that's not been peer reviewed yet, but suggests that these sorts of smartphone use scales don't correlate particularly well with actual smartphone use, but they do correlate well with things like mental well-being, so negative issues in well-being. So there's a question around what it is that they're actually measuring. The other thing to say is that a lot of research in this area is longitudinal in nature or cross-sectional in nature, and they're good because they provide us quite a broad overview of what's going on in thousands or tens of thousands of people. But because of the nature of those sorts of studies, it can often be hard to infer causality. So you can, if you're particularly looking at people's behaviors and activities at a single time point, so lots of smartphone use, lots of negative mental health effects, it's difficult to infer causality from those sorts of findings. Also, from a kind of public engagement, science communication perspective, these are often very complex studies that are quite difficult to interpret the findings of. It's not usually the case that you'll see a simple, as one thing goes up, another thing goes down sorts of results. And like I say, the caveat additionally is that all of this research has been done in a time before coronavirus. So current events, the extent to which we can translate those findings, we're not quite clear on yet. Hopefully some positive messages though. So a study that came out recently by Downey and Gibbs suggests that actually if we're worried about things like face-to-face social skills in kids, maybe we don't need to be as much as we are. We call this the kids these days effect, and I'm sure we're all responsible for this in some way, shape, or form. That we think about what our childhoods were like, and we go, "Our kids these days, they don't know they're born, and they don't do the things like we used to do." Just kind of look through rose-tinted glasses of what our childhoods were like, but actually things aren't getting worse by a lot of accounts. So this study looked at the early childhood longitudinal study, which is a study in the US that kind of goes on year, and basically compared evaluations from parents and teachers of kids' social skills from 2 time points, so 1998 and 2010. 2010 is not now, obviously, so we've got 10 years of social media and tech changes to account for there, but that's the latest year for which the data is currently available. But what they found, nevertheless, was that there doesn't seem to be any differences in face-to-face social skills. So it's not the case that kids in 2010 were rated as being more poor at social interactions than their 1998 counterparts when accounting for things like increases in screen time use. There was basically no evidence for any effects of screen use on well-being. Actually, generally, although they were non-significant findings, so basically there are no differences, there were very slight improvements. So certainly not in the direction that you would expect if you think that screen tech is a negative thing. There were some negative associations in that study. So for very, very heavy social media use or very heavy video game use, there were some negative impacts on social skills, but these were tiny. And this is the general finding that we've got from the best research evidence out there at the minute, that if you look broadly across all sorts of different types of screen time, either the results are inconsistent, so you find some negative or some positive effects. The best stuff says that there's not really much in terms of effects at all. Where those associations do show negative slants, they always tend to be small and really not worth worrying about. I think Amy's going to go into this in more detail, but she published research last year with Andy Shabilsky at Oxford that was based on, I think I'm right in saying this, that it was 3.2 billion analyses. It's a wonderful, crazy paper, and I've got the link to it at the end of these slides. Or basically, what they were trying to do is show what the effects of digital tech use are, and the take-home message there was that if you're looking at it in the context of well-being, there's very little effect of digital tech use. But also the fact that you can do so many different sorts of analyses using different types of measures and different aspects of measures shows that, we really need to be careful about how we ask these sorts of questions. Other research has just shown that basically if you take what's called ecological momentary assessment, which is where you get adolescents to kind of self-report a few times a day on what they're doing and how they're feeling. If you do that over a 14-day period, there's no suggestion that on days where kids use screen time for more of the day, that seems to coincide with days where they're feeling more depressed.
So Pete, just a few minutes, just quick reminder.
Yeah, that's fine. So that's the sort of good. We don't need to worry about these things too much. I think there are some areas where we do need to be careful. So there's some evidence to suggest that where we do see risk of online harm in things like bullying and victimization and some forms of mental health issues, they tend to mirror what's happening offline anyway. At the same time. So kids who are bullied offline tend to be more likely to be bullied online as well. Again, though, we're not sure what the causal direction is there, and it depends on the type of screen use and how they're engaging with it, where we'll see those sorts of effects, that affect directions. We'll come back to this. I'm going to skip this because I'm just conscious of time, but technology is a good thing though. Technology is a tool, right? So we've got to use it responsibly. So there are ways in which we can leverage it to try and maximize the positives to make treatments or interventions more available, particularly at this time when people can't get out of their houses anyway. I do research on video games. The general take-home message with video games is that there's not that much to worry about, really. Violent video games don't drive kids to become more aggressive or towards murder in the most extreme cases. Those sorts of claims are overblown. The best research suggests that the effects, if there are any, are minimal. When we worry about things like addiction, similar sort of thing. So the WHO included gaming disorder as a clinically diagnosable condition last year in ICD-11. It's not a particularly good measure, so we don't have any consensus on what the prevalence rate is at the minute. The diagnostic criteria are pretty much all over the place. For the vast majority of users, video games aren't going to be addictive, so that's not something that I think we should be worrying parents about now. The last thing that I just want to say very briefly is that obviously things like the rules around screen time and the research about it don't necessarily apply in the current situation. What can we do here though? Well, I think these three things, flexibility, curiosity, and conversations, are really the key thing. So we know generally that hard and fast limits don't work in typical situations, so they're even less likely to work when everybody's stuck in the home now. We know that conversations, collaborative, positive, supportive conversations with kids about their tech use are the best way to go. So if you try and kind of impose an authoritarian approach where you say, no more than an hour of video games now, there's some lines of research that suggest that if you do that, kids are more likely to rebel and do it anyway, but they're also more likely to hide their tech use. And that's a situation that we really don't want to get into, because what we need to be doing in these sorts of situations is understanding what and how and why and when and who with they're using screens. If you provide a more supportive environment saying, well, I would like you to not do this because of these reasons, why would you like to do it? And try and instill guidelines that way. Kids will still rebel because they're kids, but they're much less likely to hide their tech use. So all of this is couched within an idea of, and I know it's a really hard thing to do, trying to understand more what it is that kids are using, what video games are out there, what different types of social media are out there, so that we can generate those positive conversations with them about what we would like them to use and what the best types of use are. I'm just going to stick that slide up for a second. These slides will be available later on anyway, but there's lots and lots of resources out there with parental advice guides on what different apps and games do what and what are most appropriate for different ages. And the best guidelines that we've got for screen time out there are from the RCPCH, which are available at the top.
Thank you very much for joining us for this recording from one of our Emerging Minds webinars, focused on how we can best support children and young people during this time of COVID-19 and what research can offer us. We are planning a range of webinars and you can find details of those on our website. And please do also get in touch to let us know what subjects are on your mind and what you'd like to focus on next. So a quick word about Emerging Minds. We're a research network funded by UK Research and Innovation, and members come from all sorts of disciplines and sectors, but we're all working towards reducing the prevalence of mental health problems experienced by children and young people. We really invite you to get involved, so please do sign up to keep in touch with our newsletter via our website, or keep in touch on social media, for example, Twitter. We also wanted to talk to you about a survey we are running at the moment called CoSpace. So we want to learn how families are coping with the challenges of COVID-19. So if you're a parent or a carer of a child in the school years from 0, so reception and foundation, to 11 in the UK, please do consider taking part. And your responses will really help us to find out how children, young people and their families are getting on, what's working for them, and how we can best help. Please do also spread the word to your networks and colleagues too. You can see there some of the findings that we've shared so far from the study, and on our website you can find resources particularly for parents and carers and people that work with children and young people, like the one here on the screen about supporting children and young people with their worries. Thanks again for listening, and we hope to keep in touch with you. All the best.